I think most everybody has friends or family that have had an overdose death. We all know people.
We've had a lot of loss. Those are people's loved ones, their families, their neighbors, their church members, right? Like, it's all connected.
I'm Fox 13 investigative reporter Taylor Stevens. For years, this community has been hit hard by drug overdoses.
It definitely is more deadly, more risky than it's ever been before.
It's so potent, and it's being put in everything. Even people that don't like opiates are testing positive for opiates because of fentanyl.
Now it's reckoning with the impacts of fentanyl, an extremely dangerous and addictive synthetic opioid. I'll explain how the community is working together to address addiction and the barriers to recovery that still remain.
Grateful for my trials and triumphs.
At this peer support center in Price,
I'm grateful for a second chance to live.
the walls are covered in notes
I'm grateful for your help.
written by people overcoming addiction.
I'm grateful for friends finding their way to recovery and our own second chances.
What they're grateful for now,
Face anything. Feel your relief. This is my moment.
and what they hope their futures will look like.
It makes me really emotional. It makes me feel very humbled to the fact that I get to be with people in such a vulnerable space, and they're willing to open up and talk about the things that they want to change and who they want to become.
Mercedes Morgan is the program manager at USARA, a nonprofit that provides peer support for people overcoming addiction. She celebrated a decade in her own recovery on May 6th.
When I get to be the support person for someone who is hitting a huge milestone in their life, I remember what that felt like. I remember the women that cheered me on when I got to go through those experiences.
USARA is one group tackling the complex problem of addiction in Carbon County, a part of the state that's been disproportionately impacted by drug addiction since the opioid epidemic in the early 2000s. Between 2021 and 2023, Carbon, Emery, and Grand counties had the highest drug overdose death rates in the state. And fentanyl, a synthetic opioid, has raised the stakes.
Unfortunately, fentanyl is in almost every illicit substance right now, and it's incredibly addictive, and so it's pulling people back, and we're just trying to give them an opportunity to stay alive so that they have a chance at this.
Fentanyl is accessible here. I think we're part of the pipeline to get illegal drugs into the state.
Carbon County Sheriff Jeff Wood says his officers first started seeing fentanyl around 2015. Now it's everywhere.
Honestly, I almost expect that now when we do drug busts that there's fentanyl in whatever we got, just because that seems to be what they've done to make their product that much better.
Fentanyl is up to 50 times stronger than heroin and 100 times stronger than morphine. It's cheap to manufacture and easy to mix with other drugs, including ones that look like prescription pills. So people don't always know they're taking it.
They don't know what they're doing. They don't know what they're getting. They're not told, hey, this has fentanyl in it.
Many people in Carbon County work jobs requiring hard physical labor, and the sheriff says he often sees opioid addiction start with legitimate pain.
It can happen as innocently as you're a coal miner that went out playing on your three-wheeler over the weekend and got hurt and had to go to work, so you started taking opiates, and it wasn't enough. And then it moved on from there into more hard things and street drugs, and pretty soon you're addicted and you can't get out of the mess you're in.
People also can use substances to cope, right?
Ashley Yager works on addiction issues at Utah State University in Price. She says high levels of generational poverty and generational substance abuse are other factors that contribute to addiction in the community.
If they see their parents using alcohol, using medication, sometimes that's what they go to.
Mix all those factors with a lack of recreational activities and
It's just kind of the perfect storm.
once someone's addicted, other aspects of life in rural Utah can make it feel harder to access treatment.
I think Being in such a small community does make it harder for people to reach out and get help.
In a place where it can seem like everyone knows everyone, advocates say the stigma of drug use can make some people wary of asking for help.
But I think in the last few years, there's been phenomenal work in this community that has really created a culture of recovery is a beautiful thing, and it's okay to recover out loud. And I think that has been huge in reducing what some of the stigma has looked like for people in Carbon County.
But advocates say there's another barrier to recovery that has proven even more significant.
We have no public transportation.
There is no public transportation.
Transportation. It's absolutely one of the largest barriers.
Melissa Huntington is the executive director of Four Corners Behavioral Health, which provides treatment to people overcoming addiction. She says there are more services available in this part of the state than ever, but sometimes people struggle with transportation to access them.
There is no public transportation in any of our areas, and so we have had to find funding and grants or different programs that we've built our own transportation in-house.
She says about half of the 130 to 160 people in Four Corners opioid treatment program wouldn't have another way to get there without it.
We have 5 buses that go out, big vans that go out and go to different location pickup points and bring people in to receive their medication and then take them back home.
Life in rural Utah comes with challenges. But as Carbon County providers respond to the dangers of fentanyl, they also see their small community as an asset.
We're here because we have been directly affected. You know, we live here. The people we're serving are our neighbors, our loved ones, our family members. And so my staff are incredibly passionate about the work they do. They put in 110%.
Because when everyone works together,
I think that is the shining light in our community, is how much people care and how connected we are.
there's hope for a better future for those who are struggling now.
Everybody that's addicted to a substance has someone somewhere that loves them. And I get emotional, but it means a lot to get them the help that they need. We can't forget about them. We have to help them.
And for future generations who hopefully will never face addiction.
I can't even imagine what the youth of our future are going to do, because the landscape is going to be so different than it is now in 8 years.
In Price,
But I think if we give them that potential,
Taylor Stevens,
they can change their lives and the lives of everyone that they come into contact with.
Fox 13 News,
And that will really ripple across Utah and the United States, I think, as a whole.
Utah.